Afternoon, North Dakota. Again, I want to thank all of the folks who are listening in today live or who are watching on replay. We appreciate your joining us and being part of the dialogue and conversation. I do want to start by just saying we know that as we move into month 7 of this pandemic in North Dakota, that there's a lot of cumulative stress in North Dakota. And so I want to thank and share my gratitude with those individuals, whether there's parents, teachers, healthcare workers, local public health folks that we have working so hard, kids whose lives have been disrupted, grandparents, and those that are elderly that may be living in the daily fear that they may catch something that's going to be cause a very serious illness or death. We just know that there's a lot of stress, and of course with the economic disruption that's also accompanied this, we know that adds to the challenges that people have, and that the people are feeling that. And then we throw into that the challenges we've had in whether it's in the oil industry or the challenging year we've had in agriculture. It's just putting a lot of pressure on people across our state and across our nation. And I think that here in North Dakota, there's a time here where we know that when we've been through challenging times in the past, whether it's particularly, I think floods are some of the best examples where entire communities have been at risk or have suffered sort of the loss and the grieving that can come when you lose something, whether it's losing a flood in a house or lost time or other impacts from these kinds of natural disasters. But during those times, we know that North Dakotans have risen up. We know that people have stepped up with incredible grace and compassion. We know that faith-based communities have come forward and supported people. We've seen it this fall in the ag community when one individual was unable to complete his harvest and all the neighbors came together. I mean, those are examples of North Dakota at its very best. And then I would throw on top of all the stress we have, we know that some people might say there's a information overload, but there certainly also is a misinformation overload because never at a time in our society and in our world there's been so much information at our fingertips that often is inaccurate, that is also being spread around, which just adds and fuels to the emotions of fear and concern that people have, and those can be the motive for some of that can be nothing more than the business models that are trying to capture the attention of people and on social media. So with that as background, again, I would just start by opening today to say gratitude for all of those people who are showing grace and compassion to their neighbors and their friends and their teammates, and hopefully that all of us, as we perhaps are at the point, I hope, which is going to be in history looked back as the darkest hour and maybe the most challenging time for North Dakota in the pandemic, that in this point of us going through this low point that we can look back and know that we did it with grace and compassion and understanding. Today, we're pleased to have 2 guest speakers with us, both from the North Dakota Department of Health. One is Kirby Kruger. Kirby, we're delighted to have him here. He's the Director of Disease Control. And Molly Howell, who you've heard from this podium before, our Immunization Program Manager, and she's the Assistant Director of Disease Control. But thanks to Kirby and Molly, not only for being here today, but for their incredible and steadfast work. They've been a key part of the team since the very beginning of the pandemic. And again, as we take a look and we talk about the darkest month, I mean, there's a lot of different ways to measure the pain and the loss during this, and sometimes when you look at numbers, it can just feel like statistics. But I want to start by sharing that as we concluded September, far and away from people passing away with COVID, our worst month yet. It took us 140 days battling this pandemic to reach 100 deaths, and that was in a time when we knew less about how to manage it. Today, the survival rates of people coming out of ICU ICU are better than ever before across our country with the advances we have, that's still not a place you want to be. You don't want to be in ICU with COVID, because I don't know anyone who'd want to be going through weeks of headaches and nausea and breathing issues that would probably seem interminable, only to come out the other side of it perhaps with lasting effects. But we are doing a better job of having people survive that today than we were 6 months ago because of increased knowledge and care. But even with that, we still see ourselves here with 109 deaths in September. And even if we take a look at the last week, we lost more patients in the last week of September than we did in any of the months prior. So I say this again with a sense of heartfelt loss, and because this may be a statistic number here. We know that each one of those individuals was somebody's grandmother or grandfather, father or mother, brother or sister, a friend, a neighbor, a mentor, and we feel the loss of those families, and we know that working together that we can make sure that we slow the spread and bring those curves down again in those numbers, so that we don't see any months like that ahead of us, and we can start heading back, if you will, in the right direction. 67% of those fatalities, or 67 of the fatalities, or 61% occurred in long-term care facilities in the past month. And in light of this, we're rolling out many mitigations to help our skilled nursing, basic care, and assisted living facilities to protect our state's most vulnerable population. And that includes stuff that our VP3 team has done all along, but we're going to keep, doubling down on this, that keeping COVID-19 out of our long-term care facilities, whether it's skilled nursing, basic care, or assisted living, becomes more of a challenge when we have increased spread in the community because of the number of workers that are moving in and out, and also because we want to continue to facilitate visitation between families and their loved ones, but we know that it creates additional increased risk. But facilities that are experiencing outbreaks are taking part of increased testing. The state lab is processing those. As I mentioned before, we're moving all tests from long-term care up to the priority level, so they move to the front of the line if they're coming into the state lab. So the sooner we can ID positive cases, we can get them isolated and implement infection control measures. We're taking a hard look at working with facilities who've had serious outbreaks that have led to multiple deaths at their air purification systems. There's increasing evidence that, again, that if you've got spaces where we've got your air circulation outdoors, you're much better off than indoors. You're much better off in less crowded than you are in crowded. You're much better off in places where people are wearing masks than are not. And so we want to keep focusing on that aspect of it. We also have been deploying professional cleaning services to help facilities with outbreaks to do enhanced deep cleaning of any high-touch services in common areas. We're also working on coordinating staffing needs for facilities experiencing outbreaks, because if there's a number of positive cases with residents, that means that there's a number of healthcare workers who've been exposed and who sometimes also become positive because they were a close contact. But this means we're working on deploying CNAs, LPNs, and RNs to fill open shifts in facilities statewide. We'll be redeploying some of the nursing pool staff that we had to help with those, and then redeploying and getting some of those nurses that were helping on test collections and backfill those with EMTs. The VP3 task force is also providing advisement, consulting, and support services to any long-term care facility in our state to ensure that those best practices are being followed. And there's also a collaboration happening between key stakeholders to take a look at revised visitation guidance as we head into the winter months here in the northern part of the country. We were able to accomplish a lot of visitation outdoor and safely this summer, but the stakeholders include the Reuniting Reuniting Families Task Force, chaired by Chris Larson, who's a resident of Luther Memorial Homes in Mayville, the North Dakota Long-Term Care Association, North Dakota Department of Human Services VP3 Task Force, and the North Dakota Department of Health, all working together to get input from families, residents, and facilities so that we can continue to connect residents and their families in a safe and practical manner, because the connections with family is also a key part of health. When we take a look at what we're watching, let's jump into the numbers. In terms of the statewide positivity rate, we can see the trend line overall coming up right just below 7%, 6.98%. And this is a trend line. Well, it's not climbing as steeply as it was earlier. It continues to climb. And as we know, this is an average for the whole state, and which means we've got a number of counties with more than a 10% positivity rate and quite a bit of testing. And we've got some counties that have got under 5% and some even under 3% positivity rate. So this is the average of that. But we don't like the direction it's going. We do know that we're not operating in isolation. The virus does not respect any state borders in terms of its transmission. And so when we take a look at where we stack versus other states, then this is from the Johns Hopkins University data. If you look at the left-hand side of the screen in green, those are states that have less than 5%. That's where we have spent the vast majority of the pandemic, was in that area. We're in the group now that has in the higher than 5%, 5 to 10 by the White House considered the yellow zone from a positivity. Above 10% is a red zone or a warning zone, and we are in a relative to where this virus has moved. It started out in the Northeast, went to the South, went to the Southwest, and now has come into the upper Midwest and the upper Rocky Mountains area. And if we take a look at some of these numbers, which are hard to see here, but Montana, our neighbor to the west, 8.3%, Wyoming at 12.6%, those Nebraska at 13.3%. These are all, I believe, the highest for any of these states. Kansas at 15.5% positivity rate, Iowa 17.2% positivity rate, Wisconsin 21.1%, and South Dakota with the highest positivity rate in the nation at 25.9%. So again, compared to the peer group of those in this upper Midwest Great Plains region, well, we don't like the direction of our numbers going up versus going down. There is a tide around us which is much higher, and so again, thank you to all the North Dakotans who are doing their part to help slow the spread and to keep our positivity down. And thanks to all the people that are working, around in the state lab and around in public health and in our health departments on the testing, particularly those vulnerable long-term care, to help us have accurate information about where the virus is and how we can mitigate against it. Again, we'd like to get our positivity rate back to 5% or lower. And again, we're doing this, again, trying to be simultaneously. We talk about the dual goals of saving lives and livelihood, but our unemployment rate is for the nation right now, we're the sixth lowest in the nation at 5% even. So we want to see that unemployment rate continue to drop, but among the best of any states, and that's a reflection of the fact that we've largely kept the economy open. As a matter of fact, the Kaiser Family Foundation reported just recently that North Dakota is among 8 states that have their economies entirely open. And so if we can achieve these dual goals of having an open economy and helping to maintain people's economic health, that always helps the physical health and the mental and behavioral health. So if we can do that and continue to have low positivity rates, that's the path we're pursuing. Another goal that we've had, or I should say before we go into another goal, but let's go into the numbers for the statewide numbers. We had 2,848 new cases in the last week. but also a large number of recoveries. Divided by the number of tests we completed, that was a 7.4%. So that's slightly higher because that's a 7-day rolling average. When your numbers are going up, your 7-day average is always going to be slightly higher than your 14 days. So the 7% I was referring to earlier is our rolling 14-day, but on a rolling 7-day, increasing to 7.4%. And again, 3,690 confirmed active cases, up about 29 from yesterday. We do have 106 people hospitalized. Since we were here last week, we have had we have had an increase in hospitalizations. We've broken into that 100% mark. There is going to be additional updates coming next week to our dashboard. We have been working with local officials and with the hospital association and with the Department of Health to make sure that we are getting, as we can, additional transparency out on the dashboard so that daily everybody in the community could understand how many people we have hospitalized within, at least within the main tertiary hospitals, the largest hospitals we have in our state. We want to be able to, so people can see how many beds are occupied by COVID patients and how many ICU beds and how many there are totally. And we're working to make sure that we're working to clarify the difference between licensed beds in the states and those that are staffed, because it's one thing to have a licensed bed, but it's also important that we have the staffing to be able to do that. But as hospital organizations continue to climb, the COVID percentage of that continues to be very low. And in working with, had a call with all the North Dakota Hospital Association yesterday, talked to individual facility leaders over last weekend and this past week, and they're all assuring us that while they're seeing increased admissions, the majority of those are non-COVID related, but there also is this increase of COVID related patients, but they remain confident that they can meet the needs of their communities and regions. But again, this is something we want to monitor closely to make sure that we can have the hospital capacity necessary. But again, if you're concerned about healthcare system availability and you're healthy today, there's some simple actions that you can take, which include socially distancing, wearing a mask, washing your hands, avoiding large gatherings, because if you yourself do not become sick and then you won't infect others, then that'll help take pressure off of the system. One other thing I want to mention here also when we talk about this topic here is the White House call from last week. We did find out last week on Monday, we've talked about this, but as the White House had earlier announced that they were buying 150 million tests that the Trump administration had secured, and those tests are 15-minute result time, and they don't require being transported to a lab, and they're 97% accurate. So you have those initial tests are starting to come. 14,000 tests are on their way to North Dakota right now. The Binax Now rapid point of contact tests, and that'll complement our robust testing strategy that we have that's allowed us to keep our schools open and our economy open. But there's a number, these will be a complete game changer in terms of how we'll be able to use these. By the end of December, we expect to receive 220,000 of these cost-effective, easy-to-use tests in North Dakota, and that would be our per capita share. The White House announced on Monday that they're distributing these to the states on a per capita basis, and we're still working on finalizing the actual distribution plan for those tests. But one place we anticipate using them, for example, would be both in nursing homes and in school settings. For example, if a student presented in a school with symptoms, the school nurse could give a test right there in 15 minutes, know whether the person is positive or not, and even if and again, this could allow to versus that multiple day holding period where maybe somebody gets sent home for a day or two waiting to find out their test. test. Same thing within nursing homes, whether with visitation or with residents or staff. It could really be a game changer to have that information. Also, it's a game changer in terms of cost, because if there's no lab cost and no lab staffing, not only is the test substantially lower, but the labor cost, the transportation costs are eliminated almost completely. And so this is one point of great optimization. My second point of optimization coming out of the White House call on Monday related to vaccines, and there continues to be strong progress among multiple U.S. Pharmaceutical manufacturers that are moving through very large human vaccine trials. And if we were to see say in Q1 of 2021, a vaccine that could be used for people 70 and older in long-term care facilities and really reduce their risk, that would also be a game changer in terms of how this country and our state could be working our way through this pandemic. I want to take a look at the counties next, if I could. In the county, active cases by county, again, darker on this means more cases. These are just the numerators. These are just the raw number of cases. These are not at all divided by the denominator, which would be population. But we do see here on this map that of the 53 counties, again, all but one have at least one active case of COVID. So there is a disbursement across the state. It is concentrated in the counties that have more population. Burley has 684. That's the most. An additional 265 in Morton County. Combined Burley-Morton County, 940 cases right here in Burley-Morton. And again, the Burley-Morton Task Force continues to work to try to address this. But again, people that are shopping or coming into Burley-Morton, again, you've got say a higher percentage chance if we take a look at the active cases per 10,000, which is where we start dividing by population. You can see that in Burley-Morton or in Stark County, where there's 319 cases, but that translates into over 90 per 10,000. That is, there's 3 times the concentration of cases per capita in some of our western counties than we have in some of our eastern counties. And so again, we also look at the per capita rate there. Emmons County leading the state in terms of a low population county, but leading the state in terms of cases per capita. And again, we've got as we've talked about, and we met this week with local city leaders, there's some great work being done on the city and the county level in these areas of high activity as people are taking mitigation steps at the local level to try to address their unique situation. On county risk levels, this is something we've talked about every week, where we've got the five level risk. This week we're announcing no changes to the September 23rd risk levels. We of course continue to monitor all of the positivity rates and the concentrations and the directions that they're going, but we'll be back taking a look at providing any updates to this over a 2-week period next week. So we'll have potentially have some changes both up and down next week, but for this week we're leaving everything where it was as of what we announced on September 23rd. The next topic we want to talk about is a important one, and it has to do with the topics of isolation and quarantine. And let's get clear on the 2 words. Those isolation is something that if you're positive, then you should be isolated, because if you're positive and you're contagious, then you should be in a position where you're not in close contact with any other people. People that are attending to you should be thinking about using PPE to protect themselves, but you want to be isolated so that while you're positive, your first thing, of course, is to take care of yourself. If you've got symptoms, contact your health providers and make sure that you take this disease seriously. But you should be in a position where if you know you're positive, then you're not transmitting to anyone else. Quarantine is a procedure where people who've been exposed to someone who's positive, we ask them to quarantine. We do know from the studies we've done at the university, students through the NEUS, that about 25% of the students that were quarantined were, because they had a close contact with a positive, later turned out that they also were positive. Statewide, the numbers are a little bit higher. They're 29 plus percent, so close to 30% on of all of the people that have been contact traced who were a close contact later turned out to be a positive. So this is an area where we know that there is a substantially higher likelihood that you will contract COVID if you've been identified as a close contact. But having said that, so we know there's risk, we want to make sure that we're achieving the most compliance we can, and to make sure, we want to make sure we're providing some clarity to our quarantine guidance. But there's we know that right now that again, COVID is also transmitted primarily, through the air, human to human, and so it's, again, if humans can stay away from each other, then the virus has got no place to live, and that's why, again, we keep talking about these guidelines over and over again. But these are common sense measures that don't infringe on anyone's liberties. That are not, these are guidelines, not mandates. So you can choose to do this as you care about others in your community, which is keep your distance, wear a face covering. If you can't socially distance, wash your hands frequently, avoid large gatherings, and stay home if you're sick. And let me just say something again on masking and face coverings. Think about it, when a mask or a face covering, as someone who might, if they know they're going to cough, they cover their elbow. And if in pre-pandemic, if you were in a close conversation with someone and they had a cough and they turned away from you or coughed into their elbow or excused themselves, you probably would, say to that person, or if they sneezed, you might say Gesundheit in parts of North Dakota, but you would say, you're basically seeing that what they're doing is acting out of consideration for you. They're not trying to keep themselves well. They're trying to protect what just came out of their nose or mouth from their cough or their sneeze from going on you. That would be, common courtesy that we all practiced, I think, all the time, almost uniformly. Putting face covering on is kind of like covering your cough, only you're doing it because we now know that when you're asymptomatic, you can still be a transmitter of this disease. And so again, I say, as I said last spring, the one thing, if you see someone wearing a mask, there's one thing to say to them, and that's really thank you, because they're protecting you the same way they are when they're protecting, when they're covering their cough if they were in your presence. And so again, this is just a common sense thing that we knew before the pandemic, that it was not a good deal to cough or sneeze directly in someone's face. We knew that if you're a surgeon doing surgery, you wore a mask in case you might have sneezed in somebody's open surgical incision. I mean, these are just common sense things that we all understood, and so we're trying to bring that common sense forward, that keep our distance and wear these face coverings if you can't.